if that group of people who convened as a group of angiographers or special proceduralists or whatever name you came by at the time were to guess what this would look like 50 years later, I'd probably guess that we've surpassed what they could have imagined. Being recognized as their own specialty, having our own board certification, and now pushing to move this globally in all corners of the world is a huge accomplishment to those who preceded us and the vision that they had for the specialty and for the field of SIR. Our organization has led the way nationally and globally.
The greatest shift is that it has evolved into its own specialty and taking a life of its own, and it will continue to evolve on its own two legs and not dependent totally on diagnostic radiology.
The drive towards clinical patient care and interventional radiology really came from the explosion in therapeutic interventions that happened in the 90s.
The huge change has been the fact that it's a clinical practice, so that we see patients in the office. They're basically admitted to our service. They come in, get their procedure. If it's going to be an outpatient, they go home and see us in follow-up in the clinic.
The absolute best transition that I've seen is the way people have embraced our role as clinicians.
Both the internal recognition and the external recognition of interventional radiologists as being medical decision makers and patient care providers, not just people who do a procedure in a response to another physician's thought that it should be done. So we are actively contributing to the care of patients, both in procedural decision-making and planning and post-procedure care, and that's totally different.
It's better patient care. It is a better way to interact with patients, and it's a much better way to interact with referring docs.
Well, I think it's been quite a ride from participating in a discipline in which no one knew what our boundaries were to a well-recognized subspecialty in medicine that is now one of the most competitive fields in which young, bright people can go into. It's really been a pleasure to be a part of that process.
When you think about the different diseases that interventional radiology touches and has a major impact in, the range of innovation that we've added to the landscape, the fact that we started out as just these, sort of pioneers in radiology departments or wherever, and ended up becoming a specialty that attracts really the best trainees to its residency program each year. It's truly an incredible success story.